Firstly, we're going to do some hands-on massage, and these are my 3 favourite techniques for medial tibial stress syndrome. The first one is just some gentle soft tissue mobilisation, where we start with the hands behind the calf muscle on the lower half and bring the soft tissue forwards, particularly paying attention to the inside where we're rolling that soft tissue forwards towards the tibia. And before I started this, I put a little bit of oil onto the skin. That's not necessary for this technique because I'm locking into the skin and pulling the soft tissue forwards, but it'll become more useful as I show you the next 2 techniques. The next technique is a bit more specific. I'm going to hook the end of my fingers and come in just behind the tibia there, and then I'm going to provide some counter pressure on the outside with my other hand. So most of the focus pressure is on the inside, hooked behind the tibia, and I'm going to come down and definitely want some oil on the skin for this so that you can slide down, right down to the lower tibia, dropping behind that medial malleoli ankle bone just here. The third technique is the most intense. For this one, we come down to that painful region. Once again, we lock in behind the tibia there, pressing in with our fingertips right over the painful area to the patient's tolerance. So keep an eye on your patient's facial expressions. If they look, or if you're doing this to your friend or family or even on yourself, if you have a facial expression like this, then that's not so good. It's probably causing far too much discomfort. But a facial expression like this indicates you're probably using the right amount of pressure. So you can sustain the pressure until the pain starts to reduce and the sensitivity of that area has reduced. Or you can add in a little bit of soft tissue mobilization as well. One of my favorites for this area is to use cupping, in particular glide cupping, so the cup is attached and then glides across the soft tissue. And this can feel quite nice because it pulls on the soft tissue and often creates a nice releasing feeling as it's pulling and decompressing rather than the compression that we were doing with our fingers. We can also use the rock blade to do some instrument assisted work over this area. And if I just lightly rub repetitively over this area, this is called feathering. This can lead to some temporary pain relief over this region. We can use it in a bit more of a focused way with some more pressure, and once again come down the back of that tibia, that shin bone, as we were doing with our fingers, but this is another way, and perhaps a way which helps reduce fatigue in your hands, especially if you're doing a lot of hands-on work